Okay, so this video is going to be about how to be ready for any MRI. Okay, so what's it like? Do you know what it takes to be ready for your MRI? So if you clicked on this video, this information is going to help you better understand what to bring and what not to bring, what to do and what not to do, and most importantly, what to wear and what not to wear for your MRI examination. Now, this information applies to almost any MRI, and be aware that there's no wrong answers here, okay, or right answers. Everywhere is different, so you may want to follow directions given to you by your preferred um, MRI office, okay? Okay, so you you want to have authorization from your medical insurance, okay? Unless you want to pay out of pocket, which is going to cost you about $2,000 or $3,000 for each MRI that you do, right? So we don't want to have to spend more money than we need to. That's why you need authorization from your medical insurance to have it handy. Now, you want to call them yourself, okay? Because sometimes they are able to give you more information because you are the patient. Um, so the last thing you want to do is show up because you had an appointment but you don't have the authorization. Okay, so that's basically gonna make your day miserable, right? We may ask you to come back another day. We don't want that. Now, some places that you may go to, they can work your authorization for you because we are used to that, but it's not ideal for you, okay? All right, so let's talk about the MRI screening questionnaire, okay? Um, this is this is where most patients get it wrong, and it is exactly the most important part of your examination, okay? So if you can have the MRI screening questionnaire ready before the day of your study, that's great, okay? This is basically going to ask you safety questions. Okay, do you have a pacemaker? Do you have hearing aids? Do you have braces on? Okay, um, this is going to speed things up, and this will also give you more opportunities to be more specific with your answers, such as what happened to you? How long have you had this? Long have you had this problem? Okay. Um, See, most of the time, you are already nervous about your study and can't seem to think straight, right? So, having time aside, maybe at home, maybe also getting help from a friend or a significant other, all these small details will make you at ease for exam day, okay? So, the longer you have to answer a question, the more things might come up that you didn't remember at the time. So that's why it's crucial for you to have some time aside to answer questions correctly and abundantly, to be honest with you. Okay. Uh, we also want to know about your prior surgeries. If you have hearing aids, implants of any kind, stimulators, etc. Right? So you want to be honest about that. Um, so you want to know if you have had surgery of any kind. And believe it or not, some people don't remember if they have had surgery of their knees, elbows, shoulders. They don't remember. So again, going back to the other questionnaire, if you have time to think about that, you'll remember. If you had an implant, you'll know beforehand which implant it is, what model it is, if it's MRI safe, okay? So it does not matter if your exam is not related to your prior surgery area. You could be having a brain MRI and you had, lower back surgery, we still want to know, okay? Chances are you are a pretty healthy individual with zero metal in your body, okay? But if you have had surgery, we want to know where and if you have any sort of implant inside your body. If you do have had surgery in the past, and say you have a a pacemaker, or a stimulator, electronic monitoring device for your heart or your sugar levels, medication patches, surgical clips, hearing aids, and even a screw in your bones. Okay, we want to know about that. I will cover implants in a separate video if you're interested about that. Okay. Um, Also, if you work in construction, grinding metal, or any sort of hands-on job, we also want to know that. Okay, that's important because sometimes it depends on where you go. But if you have, uh, if you work at a metal construction place, say for example, and you have been exposed to metal, some places you have a screening x-ray before your MRI just to make sure that you're safe to go into the MRI suite. Okay. Also, if your examination requires contrast, bring the most recent labs. Okay. And by recent, I mean it'll be 30 days or less. Okay. This is a standard in most places. You don't want to show up with expired labs dating, 3 months back, especially if you know that you have kidney issues. Okay, I'll cover that in a minute. So 30 days or less is ideal. Um, in some places, it is required for everyone, regardless of age, and in other places, you will only need it if you are 60 years of age or older. And if your GFR, this will be in your labs, by the way, is less than 60. Okay, in some places the standard is 30. What that means is you have to comply with whatever protocol there is for the place you're at. Okay, in some cases your labs will be consulted with the a radiologist, and they will decide how to proceed. Okay, not your primary care physician, because your primary care physician might have said, "Oh, your kidneys are working fine," and the radiologist, the one in charge of the office in a radiology department, may not like your labs. So he or she will have the ultimate decision of whether or not to accept you as a patient. You have the right to go somewhere else for that. Okay. So if you have had kidney surgery, if you suffer from kidney disease, you need to have recent labs. Why? Because the contrast, if you require contrast, the kidneys are going to flush the contrast. And if you have kidney disease, that means you're not going to be having very good functioning kidneys for that contrast to be flushed out. Okay? So that's why you need labs. Um, Now, do you need to be fasting, right? For most exams, you do not. Okay, so know before you get to your appointment if you need to be fasting. Generally, like I said, you don't need to be fasting if your exam doesn't require contrast. Okay, if you have an abdominal MRI without contrast, I would advise not to eat before the exam, right? And this is because in most abdominal MRIs, we also look at your gallbladder. Now, if you eat in the morning or if you had a drink of some sort, your gallbladder will shrink, okay? And we can evaluate your gallbladder fully, okay? Like it should be, okay? So when you don't eat, when you're fasting for about 6 hours, your gallbladder will be full. Okay, it won't shrink and will have better images of your gallbladder if it may be, okay, or if it needed to be a gallbladder study. Now, it doesn't matter. It could be for pancreas, or if it could be for kidneys. We also look at the gallbladder, okay, as part of your abdominal examination, okay. Some places allow you to eat 4 to 6 hours before, but if you can hold off, do it, okay. Uh, you're fine with insulin and other routine medication, okay. I know some ultrasound examinations, they don't even allow you to brush in the brush your teeth in the morning, right? But with the MRIs, if you need your insulin, if you need your high blood pressure medication, if you need just any type of medication that you need, except for I would say metformin, okay, anything that you take by mouth for your sugar or for diabetes, but you're good. You're good with insulin. Okay, so you can eat in anything you want if your exam doesn't require contrast, and if it's not a an abdominal MRI or even neck. Okay, I would add neck because sometimes people tend to leave some things in their throats, and if it goes down the wrong path there, and you have GERD disease, that's gonna be a problem for you. Okay, but if you do require contrast, do not eat. Okay, please and thank you, because say that you are not allergic to any of the contrast information, which I will do another video about, but what if you become allergic to the contrast? Now, we don't know if it was a reaction between the contrast and what you ate in the morning, or was it just the contrast, right? So that's why we like to keep those two things separate. Let's talk about arriving on time, right? Give yourself a little cushion for this one. MRI exams tend to be slow, even when everything is running as it should. MRI screening questionnaire are lengthy. Okay, they're different from place to place, and they are a bit confusing to understand, especially for the first timers. Okay, so arriving about 30 minutes before your scheduled time is of great importance. Okay, doesn't matter if you've been there 1,000 times. Just be early. Okay, if you cannot be on time, just then be early, right? This will give you enough time to do your thing in the restroom, especially if you drove for a long period of time, just to get there, right? I can't tell you how many patients need to use the restroom right when their name is called, creating even more wait time. So by the time you're done doing paperwork with the front staff, there goes 15 to 20 minutes of your time. If you're running late, call ahead, okay? Chances are by the time you arrive, you're now onto someone else's spot, okay? Someone else's time slot. And although most centers are okay with taking late arrivals, some will deny future access to their facilities because this means lost money for them, okay? You didn't show up, you didn't call ahead, and you cost them money. Okay, some centers will make it up by accepting walk-ins, but this isn't always the case. Also, if you are already decided with your primary care physician that you need medication due to claustrophobia, take medication only if a MRI personnel has told you so when you arrive, not before. Okay, the reason why not before is because first of all, we want to make sure that you took the correct medication, okay, the one prescribed by your doctor. Two, we don't want it to wear off. Okay, so if you take it 30 minutes before you get there or when you get there, by the time you're called, the medication is really not going to help you. Okay, it would have helped you 5, 10, 15 minutes into the medication, but so just wait for an MRI personnel to tell you, okay, you're up next. Is going to be 5 minutes before I call you back. Now you can take your medication. Okay, that's usually the way it works. So little hiccups add more time to MRI studies, believe it or not. Okay, so this isn't just pressing a button here. There's a lot of things involved, and what to wear, right? Bring all metal. Not really. Okay, it's this is a very simple. Okay, all cotton clothes with absolutely zero metals, including waist string holes, zippers, string fasteners, metallic letters. Uh, Honestly, the best way to go is pajamas, right? Good old simple pajamas have almost no metal ever. The rule of thumb is if you're unsure whether your clothes have metal on them, the chances are they do. Even if you don't see them, okay, we have trained eyes to just to spot metal from a mile behind, right? Or a mile away. So even if you don't see them, it might be there, okay? You don't have the trained eye on how to spot the metals, okay? This means no jewelry also, or piercings of any kind. We can spot them in a split second, okay? You may not even remember that you had them on, okay? So notice I didn't mention sports clothes, okay? Because some of them do have stretchy metals in the fabrics, okay? And even the most or even then, most centers will require you to change into one of their gowns for safety reasons, okay? And even use a metal detector before entering the MRI room. Nothing for your hair either, okay? No makeup or body lotions or body perfumes whatsoever on any part of your body, really. I don't want to overwhelm you on too much information. I can talk for another 5 minutes just on this subject. But the last thing I will say is, if you are told to change into a gown, don't fight it. Okay, we're doing it for security reasons. Okay, well-being of everybody. Okay. The same procedure applies for someone going inside the MRI room with you for emotional support. Okay, so whoever is going with you has to be maybe not in a gown because they're not going into the MRI machine, but they do need to have all their medals taken away from them. You will have a locker for that, and you'll have the key for that too. How long does it take? Right? It's one of the most common questions I get. That being said, let's move on to the length, right? It usually is, let's take about 10 minutes or up to 2 hours, depending on what you're going to do. 10 minutes being a short and simple MRI, like a lumbar spine study. And 2 hours, it depends. It could be a prostate, it could be a cardiac study, or maybe breasts, okay? Now, this depends on where you go. Because different MRIs have different protocols, and those could mean that it could be 5 minutes for one exam or maybe up to 1 hour. Okay, so be ready to wait double whatever you are told. Incidents happen. Claustrophobic patients are real, even if you're not one of them. Okay, so the one before you could have been a claustrophobic patient, and we needed more time. Okay. If you're not moving, during, quote unquote, not moving during an exam, that will add more time to the study, right? So you have to be still. Down on your, I'm going to show you in a minute uh, a picture of a moving image and, a picture of a non-moving image. So you get the idea. And you already know which one is going to give you the best results. Okay, we don't have an option to kind of mask moving images. And in some places you do get that option, but those sequences will have a longer scanning time. Okay, so you don't want to be in that position. Most techs will only use it if it's highly important. Okay, say if you have a tumor and we really want to get that scan in for the doctor, we'll do whatever it takes. Okay. Um, Also, some places are busy and they just, if you want to move and not cooperate, they'll just cancel your exam. Okay. And also, we will ask you so many times about whether it is your right or left knee, hand or elbow, even though we know, we like to confirm we have the right anatomy in every step of the process. Again, I can't, stress this enough. Be comfortable being told what to do during the examination takes places. Take orders from us constantly. Being a good patient results in faster scan times. It's not about being faster, it is about creating a unique experience during your exam. You will be inside a magnet tube, open on both ends. There is light inside of the tunnel and even a fan to keep you comfortable. Okay, make sure to ask questions before we leave the room. Okay, so when we're positioning you, that is the time to ask questions and not when we go away. Okay. Um, it isn't exactly like you see in the promotion pictures with the patient and the tech standing next to you smiling. That is only a fraction of the time we spend uh, the position for your exam, right? And this is exactly when most questions arise. So you need to ask them uh, right then there, okay? Because when the noise starts, it will be harder for us to understand you. There is an intercom to hear you and a buzzer. You can press to stop the exam if needed, but no one of those replaces patient and tech, the patient and tech eye to eye contact, which most of us prefer. Okay. Other than that, you will hear some loud noises. That's what the earplugs are for. We have earplugs, and we have headphones. You can have both, or you can choose between one or the other. Um, and by the way, a lot of people ask, what is this, banging noise? This is mostly just metals inside the magnet creating your images. Okay, that you know right there could be another video. Okay, so I'll be honest, the noise is loud, but you can get used to them after a few minutes of constant banging noise. Okay, so it's not that bad. You'll get through it. um, and that's it. Actually, the most important part of your exam is actually the end of it. Okay, because that's usually where you get the most instructions. uh, Nothing else needs to be done unless you had contrast, right? We generally watch out for any contrast allergic reactions, which, although extremely rare, normally takes place during the short injection time. So we would know before you leave the room if you had any allergic reaction. Also, note the tech from any breathing problems or itchy skin. Okay, because we can probably see the breathing problem, but we itchy skin, we really can't know those. Okay, you will be told to increase the amount of fluids intake to help your kidneys essentially get rid of that contrast in your bloodstream and into your urine. Um, if you took some medication for claustrophobia, have someone pick you up. Now, before you even get there, you should have had a partner to bring you to the place. So that same someone is going to pick you up and get you to the where you need to go. Okay, so we can't have you driving under the influence of Xanax, for example. Okay, um, let's see. If you're given instructions about where to pick up your exams or report, how long it's going to be for the report, that is the time. That is when we tell you. how long is going to be for the report. So you need to listen up for those instructions. I cannot even tell you how many people call back because they were, happy that they were out of the MRI and they just didn't have time to listen to any other after exam instructions. Okay. That's pretty much all I can think of. Usually by this point, a good hour and a half has passed since your registration and post exams, and you are on your way. So, and some people, when they're done, they almost literally run. Okay, so let me know if you think I missed important information, and I will answer them in the comments below. There will be a video just on claustrophobia and MRI, so you might want to subscribe quickly. Thank you.